Hi, Dr. Drake here. The most important question on every parent's mind is, when will I see results I'm looking for? When our kids are facing tough challenges, that is truly all we as parents care about, getting them through the storm and back on the right path to healing and health. The easy answer to this question is, it depends. It depends on the child's struggle at birth, how they're doing developmentally, and how serious the current struggle is. These variables don't even account for the objective or test findings that can either take more or less time to improve depending on where you start. With this video, I'm not taking the easy road and saying it depends, because truthfully, as doctors who have experience with neurology, pediatrics, and tough conditions, and have done so for a good while, we can be quite predictive with when and how healing will occur. While this is different for every child and condition, much can be predicted by putting together your child's story and key neurological metrics we track when we start care. These neurological metrics are combined into what is called a care plan. This individualized and personalized care plan matters most because it is built with neurology and science and has a foundation on experience. It can be predictive in your child's health journey. So over the next few minutes, let me break down what goes into a care plan and why it answers the question, when will I see results in my child's care? Instead of seeing how it goes or guessing with treatment, we will go fully in on measuring, quantifying, and being predictive in what we do. It's what we would want as parents. So we go all in, giving you the most detailed information in a plan to the best of our ability. Every single aspect of the care we provide is focused on the nervous system and promoting what's called neuroplasticity. Now, that's a really big nerdy word, but it simply means ensuring that the body's most important system is able to rest, relax, heal, grow, and adapt. Those 5 things are absolutely essential to everyone, from a tiny infant who's supposed to be asleep more than awake, to kids and parents who need every bit of rest, recharging, and resilience we can in this crazy world. To build out a clinical science-based care plan, everything starts with our doctors taking the time to truly listen to your concerns. Work together to set goals for your care and dive deep with the most modern technology in the world. It allows us to truly assess exactly where the nervous system is stressed, stuck, exhausted, subluxated, and not functioning properly. If that sounds simple, and too good to be true, it's because it is. We take the time to explain, educate our patients each step of the way, and the path to healing, restoration, and full health and happiness for your family will be straightforward and never complicated. Next, our focus is on measuring neurological information. This is doing a deep dive into the function of your child's central nervous system using an incredible set of technology called the Innate scans. They consist of 3 individual scans that will find, measure, and quantify how much stress and tension may be stuck in your child's autonomic nervous system. 3 of the main things these scans are looking for are 1, subluxation, 2, dysautonomia, and 3, vagus nerve dysfunction, which are all just terms that mean a stressed out, worn out, and dysfunctional nervous system. Then we build an exact customized care plan that fits your child's exact needs. This is one of the places where our PX Doc's clinical care really is in a league of its own, having developed a first of its kind neurologically based care planning system that is now taught and used by over 1,000 pediatric chiropractors worldwide. This care planning system blends together your child's unique case history findings along with our neurological exam and Innate scan findings to then be able to tell us exactly what frequency of adjustments and duration of care your child needs. Everything is fully personalized and customized to that exact patient. No one size fits all or cookie cutter approach that's found in most healthcare. And this process is incredibly predictive. It tells us and you, mom and dad, the time and frequency of care it will take for change and progress in the nervous system to occur. This is why our favorite part of our clinical care planning process is sitting down with you at what's called a report of findings visit, going over the insight, scan, and exam findings, presenting your child's personalized care plan, and having every single one of your questions and concerns answered. This is such an exciting visit for families as they finally have a clear action plan to get their child's health and healing back on track. The incredible miracles we get to see every single day here at Innate Family Chiropractic start with a care plan. The initial changes all build on each other. This is where the simplicity of chiropractic comes in, and we look at the body as a whole, not just symptom by symptom or system by system. We focus entirely on removing neurological interference and imbalance safely and naturally without drugs. Once we get that child's nervous system calmed down, balanced, and regulated once again, it's no wonder they start experiencing better health, like sleeping better, having better regularity with their digestive system, calming that busy brain symptom tied to ADHD and anxiety, being able to calm sensory processing storms easier, better energy levels, and less emotional and or behavioral stress, and easier transitions. These smaller important changes give the nervous system the momentum it needs to hit those big goals and results like speech, behavior, struggles in school, immune imbalance, dysautonomia, developmental challenges, or delays. The list goes on. Nothing is more powerful than parents looking for hope, answers, and help for their children. Don't ever stop doing just that, moms and dads. It is always worth it. For your next steps, we would love to chat with you about building out your child's unique personalized care plan. It is unlike anything else in healthcare. Talk with one of our incredible care advocates and get all your questions answered.